We need to do an ultrasound of your pelvis and kidneys to make sure the kidney stones. So this is, by the way, so instant HPI, the way it works is that it prepares all the things that you may potentially do as a professional, and then you get to choose what you want. Let's say in the conversation with the patient, then she does, oh, doc, I forgot to tell you I'm actually pregnant, or I've been having belly pain and vaginal bleed or something like that. And you go like, oh, well, we're going to need to get an ultrasound then on this patient. Then, we already have it for you. So this is how it works, right? And then you just go like this, copy, you print it, you paste it to the requisition, and you have absolutely excellent documentation for the people that you work with as well. That means the radiologists, the lab technicians, and all the other people. You want to run tests on it, we already have it prepared for you. You copy paste this into the lab sheet, you print it, give it to the patient. Let me tell you what we're doing. 感染症を確認し、どの細菌が原因かを特定して最適な抗生物質を選択するため、尿検査が必要です。また、感染症の重症度を確認し、糖尿病のコントロールを監視するため、血液検査も行います。We need to test your urine to confirm that. Yeah, come on, bro. Like, there's no way if you don't know, like, perfect. This is like medical grade, clear, concise explanations, right? And you can see it. Are you willing to say this to the patient? You're like, yeah, I'm not willing to read this. I don't want to sound like a whatever. So just give it to them like that. Yeah, let them read this. Okay. So this is a way you go about. Oh, let's say you something more complex. You want to refer this patient to a urologist. You want to give them a work leave in their language. So if you're working international, there's no point of sending English written or a French because you're Italian. You're not going to send a work leave in Italian to a patient in freaking Japan, right? There you go. Problem freaking solved. So Google Meet will not allow you to, it will not do that for you, right? This is why this is a more precise consultation tool. Same thing, work-related recommendations in the language of the patient, okay? Say you have a back injury patient case, you need to give them recommendations. You look at them here. Do you agree with this? Or would you delete this one? Then I will delete that one. Get it? Type of thing. Furthermore, insurance paperwork. Boom. All the insurance paperwork provided. This is exactly this in the patient's language so that you can then just print it over and send it over to them if they have such a request for you. All right, going back, clinical documentation, automated translation, follow-up questions. So this, as you saw in that particular case, we have and we prepare follow-up questions because we know the initial process, it's meant to be an initiation process. It's not meant to do all your work for you. You still have to work. You still, by the way, we haven't even spoken about examining the patient. You still have to examine the patient. Now, if you're in telemedicine, you want to get that information process because you're limited in physical examination. You want to have the best, highest quality, history of patient illness. You're the best understanding of it because in reality, about 90% of the diagnosis process comes from that. All right. So in-person consultation, you saw that there is a degree. So imagine having, which like in this model, right, this idea whereby the patient is actually seeing the text there, where you can show them a text there, right? This is a way that you could go forward. When I showed you in the previous one, I was showing you the example of an output for the code that we have that we run, and it took like the UTI patient case. Well, this is what I mean. You could just show them the text in their natural language. You will see that. Okay, so medical instructions, perfect translation, right? So we got that. We discussed that just a little earlier, so that worked out fine. The test, right? We also mentioned that, and the work and disability recommendations. So this is what I mean.